Hello and welcome back to part 2 of the hydrotherapy session for the principles of exercise therapy. We were talking about the Ragaz ring method. This is generally done for people that have a neurological disability where they're floating completely supported and suspended, and we might do some things like proprioceptive neuromuscular facilitation and trying to get them to recruit weak muscles. The water gives them a chance to be supported and where they can work against the resistance of the water in a way that they can't use land. We use turbulence and resistance in different ways. Onto the Haliwick method. This is more really a traditional method for children with learning disabilities, but it's got a fantastic system in the sense that it teaches you the true essence of hydrotherapy. It uses turbulence, flow and resistance. It uses buoyancy, gravity and rotational torques. These are some of the principles of hydrotherapy, and they incorporate them in a really nice structured way, and they have 8 principles that they work from. So mental adjustment, disarrangement, transverse rotational control, sagittal control, longitudinal rotational control, combined rotational control, up thrust and mental inversion, balance in stillness, turbulent guiding, simple progressions and basic swimming movements are the more obvious ones of those. But be aware of the Haliwick method because it's a really good way to teach. And then finally, deep water running or aqua jogging. Aqua jogging is all the rage at the moment, particularly with patients in America. Both pre and post surgery, the water allows you to take off any weight bearing structures, so it's great for knee and hip replacements. It's good for elderly or people that are overweight because it obviously decreases impact on the joints, and it avoids really getting any muscle soreness. So lots of athletes are doing deep water running as part of a normal routine. It's the action of running in the water against the resistance of the water, but no impact. So it's been incredibly popular and has even become a sport outside its therapeutic use. So contraindications to hydrotherapy speak for themselves, but it's really important that you know that. Acute vomiting or diarrhea, for obvious reasons, we don't need leakage in the water, recent heart attack or resting angina, any wound that's infected, any skin that's infected, if you've had a recent neurological event that could predispose you to drowning, if you're having chemo or radiotherapy, if you've had a DVT or PE, incontinence, as we said before, some STIs, are not to go in the water. If you have widespread MRSA, acute increased temperature because the water is normally hot, shortness of breath at rest. If you're over 21 stone or 130 kilos, it's too hard to rescue you in the water. That's why there is a weight limit. Uncontrolled epilepsy and uncontrolled diabetes. Some of the precautions that you need to be aware of: if your patient has epilepsy, they can still go into the water. They've just got to be carefully watched and monitored because of the drown risk. So that be something we need to keep a close eye on. Fear of water, it's normally people getting out of their depth that they're scared of, really, rather than just fear of water. Haemophilia, sometimes high or low blood pressure, poor skin integrity, pregnancy because of the temperature of the water, kidney disease, and if you've got an impairment, either vision, sensation or hearing, that can predispose you to risk. So these are precautions, not contraindications. Risk management plan: it's really important that when doing hydrotherapy, everything is kept to a minimum. So we don't run because of the slips, trips and falls. You're going to have to liaise with the pool staff, making sure there's a lifeguard on at all times. Evacuation processes for the hydrotherapy pool if there's a fire alarm. Hygiene is of utmost importance. The integrity of the water, so constant daily water testing, and incident reports, things like never events, so somebody drowning, worst case scenario. So be aware that water carries risk. So the equipment you need, so here you can see we've got like a flotation belt, we've got some flotating dumbbells, and you've got the all-important woggles, or magic wands, whatever you want to call them. So these things float in the water and you can use them to assist with your hydrotherapy session. Hazards in the pool: obviously drowning is the nightmare scenario, which is a never event, should never happen. Heat exhaustion, might happen if you're using a proper hydro pool. Falling or slipping is actually common because the surface is wet. You can get infections, so such as things like kidney infections, water infections as well. Just be aware of that. Entering and exiting the pool is always the most dangerous. Could irritate your skin. Some people are allergic to chlorine. Water infections such as Legionella if the pool's not looked after. Electric shocks should never happen. And you can also get swimmer's ear where you're under the water. So they are the learning outcomes for aquatic or hydrotherapy. So you should be able to recall the different methods used within hydrotherapy. Things like deep water running, the Haliwick method, the Ragaz method. Some of the principles of hydrotherapy, things like hydrostatic pressure, things like turbulence and drag and buoyancy, and the core components of hydrotherapy. And these are very similar to when you do exercise, group exercise design. So when you will do the lecture, you'll watch this, and then when you do the practical, you're going to have a go at taking a group exercise class. There'll be an introduction and explanation as normal. There'll be a warm-up, there'll be a main body, there'll be a flexibility component, and there'll be a cool-down component. So the structure of a lesson doesn't change, and that's how you'll be tested for the hydrotherapy. So I wish you all the best with that. I hope it's been informative, this flipped classroom approach, and I will see you in the pool.